Right.
Here,
So
been working for United Health for
work for
14
the-
years. That's the thanks
you
you get
work
from
for
the
the
big corporation.
border. So I work for.
Yeah.
So,
I mean,
Well, I read about it in the
for
paper
the
before I
network.
got
So I'm
notice
technically
from
hired by-
from
but I'm part
MVP.
of the community
oh, you were
health.
with MVP, yeah. So
So I
did you
have
already
a-
sign?
Recording tools.
There we go.
There we go. Should I start my spiel over? I'll start my spiel over. I'll call a meeting of the Aspen County Regional Planning Commission to order at 7:01 p.m. On the 13th of November, 2024. And as I said, we are recording this and it is posted on the web, just so everyone is aware of that. Our first item today is our program. And our program today is regarding new data that's available through the 2024 Addison County Community Health Needs Assessment. And we have two guests with us here today in order to share with us some of the findings of that, who we all met just a moment ago. So that is Emma and Amanda, and I don't want to mess up your last name, so I will just, if you want to introduce yourselves, then that will be better than myself and, embarrassing myself. So anyway, I'll just turn it over to Emma and Amanda, and they can take it from there.
Wonderful. Thank you so much. And thank you everyone for having us today. So I'm Amanda Freshley, she, her. I'm a senior community health liaison and I work at the Health Network and Porter. I'm a part of the community health improvement team. And so my job is kind of the intersection between the work that the Health Network and Porter does and public health. That's kind of the lens that I bring to my work. And I'll be talking today about the community health needs assessment, which is kind of a core piece of the work that I do and also helps guide some of the efforts that I'll be working on in the future, kind of tying that work between the hospital and then some of the community efforts that are happening. And I apologize to the folks behind me. I'll kind of like turn around in case you all have questions too. And then I'll turn it over to Emma so she can also introduce herself.
Yeah, I'm Emma Cho. Thank you so much for having us tonight. I work at the Vermont Department of Health with the Middlebury Local Health Office in the Chronic Disease Prevention Program. And I am here with Amanda to support her in talking about her work with the Community Health Needs Assessment, because my role includes really supporting any efforts around, advancing community health, disease prevention efforts, and sharing, some of that involves sharing data around community health initiatives. So really excited to talk to you all tonight, and thank you so much for your time.
All right, so we have a presentation that we can share.
All right. And Addison County right there. Can you all see that slideshow?
Yes.
Yay.
Yep.
All right. Now I want to get it to slide.
Where's it so?
This is tough. I'm gonna have to decide which one. You, that's what I want. Slideshow.
Slightly different.
Nice.
Okay.
Awesome. Okay. We'll go to the next slide. Thank you for pulling that up. So tonight we'll start with a quick background on what the community health needs assessment is, letting folks know kind of what our process was, what data we pulled into it, and then move on to what the key, the top 3 priorities that came out of that health assessment, as well as some of the key themes that rose to the top as well. Then we'll map out some of the next steps, what we're going to be working on as we move kind of from this assessment to the action stage, and then save time at the end for any questions or discussion that folks would like to have too. Now, next. So the Community Health Needs Assessment is an IRS requirement under the Affordable Care Act, and it's something that hospitals need to do every 3 years to maintain their nonprofit status. And the goal is to identify what the top health needs are in the community that the hospital serves, and really get to have some upstream core causes of poor outcomes that we see, and also what some of the opportunities are for improving health in our community. The CHIP, or the Community Health Improvement Plan, that is a 3-year work plan that is based on the CHNA findings. And that's something that is also created in collaboration with community partners. So after we do this large health assessment, we can figure out what some feasible and concrete actions are that folks can take together to start to make some progress on some of the outcomes or concerning data that might come to the top when you're completing this large health assessment. And I'll talk a little bit more about that when we get to the next step slide at the end. Next. So I'll pass it over to Emma to talk about our guiding principles.
Yeah, so I'm going to talk a little bit about the social determinants of health and health equity, which I imagine are concepts that come up in the work that you all do as well in the different spheres of health that you influence. But these are really concepts that guided the process of the community health needs assessment. There was a steering committee that was members of folks from different types of organizations, different spheres of health that worked together with Amanda on this process and really brought the different perspectives into each step of the assessment. And so when we're thinking about the social determinants of health, we're thinking about the conditions and the environments where people are born, where they live, where they work, where they play, where they socialize, where they worship, and where they age, and that those things affect a wide range of their health, of their functioning, of outcomes, and risk factors in people's lives. So I think for me, working in prevention and public health, I think of the social determinants of health as a really important part of prevention work. Because they are the parts of people's health and the opportunity for healthy choices that happen before someone has an illness, before someone has a sickness. These are the things that, are in every part of our lives that can help contribute to health. So you've got the diagram up on the screen that talks about what those spheres might be, but to think of examples, it's thinking about things is, in your life, do you have access to education for yourself or for your children? When you need healthcare, is there a place in your community that you feel like you can go to get that care you need? Do you feel like your community has, access to clean air, to healthy water, to environments that are safe for you to play in, to work in, to exercise in? Is there places to find connection, to find community, and not feel isolated? Is there, economic stability? Do you feel like you have the housing you need? Do you feel like you can have your basic needs met, the things that contribute to our survival and also to people thriving? And so when we use the social determinants of health framework, we can think about, these are incredibly complicated concepts, but they're also things that can be changed over time with different efforts. And I think thinking about this framework can also help us think about the concept of health equity, which was a big focus of this assessment as well. And I think all the work that everyone's doing. And so thinking about health equity and highlighting the inequities that might come up when different groups of people or different communities don't have access to the social determinants of health, as we're talking about, when people, health equity is the idea that everyone has a fair and just opportunity to be healthy and to have access to those healthy choices. And so I think we're thinking about how the ways that this framework can really help us think about the community needs and frame the different efforts that are happening. I don't think any of these things are tackled by one person, one organization, or one system. They are, a framework to look at all the work that's being done together, and how each group can kind of work on their different puzzle piece of this. I'll turn it back over to Amanda. Thank you.
Thank you. So when completing the community health needs assessment, we used a rigorous mixed method approach and pulled from multiple different data sources. So this included a collection of quantitative data through a community-wide survey, analysis of existing health status or secondary data, and qualitative data that we collected through focus groups with community leaders, health and human service providers, and priority populations. We wanted to make sure we also heard lived experience from people in our community so that we could pick out what those key themes are and reflect what folks in our community are saying are their top priorities. For the community survey, this year we had over 1,000 completed responses, which was an increase from the 700 that we had previously. So we were really pleased with the increased outreach and engagement that folks had with the survey. We had a increased focus on kind of reaching out to folks in different parts of the community, like having it available online, of course, but also in person at some key locations like Hope, Gather, Addison County Home Health and Hospice also passed it out. Charter House had folks fill it out. So we really made a concerted effort to try to reach folks who might not be able to take it online through kind of the front porch forum posts, et cetera, that we were doing. And through secondary data, we looked at over 50 community health indicators from various sources, from local to national data sets at the Census Bureau. And the focus groups that we conducted, it was just really meaningful to hear from people who had lived experience with seeking mental health and substance use services. And we also had a focus group with older adults who have experience trying to seek healthcare and what some of those challenges are. And for both of those groups, caregivers were also invited. So we got to hear some perspectives from both the folks who are personally experiencing it and the people in their lives who are helping them kind of navigate some of those challenges. Next slide. And from this process, we had 6 top priorities emerge. And those priorities were cost of living, cultural humility and inclusivity, healthcare access, housing, mental health and substance use, and transportation. Detailed information about each of these topics can be found in the Community Health Needs Assessment. Each have their own chapter. For the folks who are in the room, I passed out a few examples of the print version. And this is available if anyone else wants a hard copy. My email address will be available and you can reach out and I'm happy to mail it to folks. And it's also available online. So there's a lot more data available than what we'll be presenting today. So if there's something that you want to dig more into, please feel free. And if additional questions come up, you are always welcome to reach out with questions. For tonight and for our next steps, which is the Community Health Improvement Plan, we narrowed it down to 3 top priorities. And so to have both that kind of feasible and meaningful work plan that we can focus on over the next 3 years, we'll be focusing on healthcare access, housing, and mental health and substance use. This came out of a prioritization process with our some community partners and community champions to narrow down which things would be the most feasible for folks to have kind of power and actually change over the next few years, things that would impact equity, and things that you would really see, you could see meaningful change on. These were also the top 3 priorities that were identified in 2021, which is the last time we did this report. And that was in the middle of COVID. So one thing that kind of came out of this process too is that a lot of the things that folks were struggling with during the pandemic were exacerbated. And so we're still seeing those same priorities really being a focus for people in 2024 and wanting to make sure that we continue working on those for folks. Another shared theme that came out is just how deeply interconnected every single one of these priorities are. So even just looking through the report and the cost of living section, you'll see references to healthcare access because healthcare access is expensive. Housing, very expensive. Sometimes one of the main challenges with healthcare access might be a lack of transportation. So we see a lot of interconnectedness. So as we're thinking about next steps and looking at what folks want to work on, there's quite a bit of overlap, and it doesn't mean that those other priorities aren't going to get addressed because they are also, they're just also interconnected. In the next slide, we'll start to explore more information about those top 3 priorities. Next slide. So for the next few slides, we'll highlight some of the key findings that were under our top 3 priorities and some of those themes that were coming up. In the community survey, respondents said that their top concerns for healthcare access were that they wanted increased availability of primary care services, more appointments outside of normal business hours, more healthcare services that were free or fully paid for by insurance, and decreased wait times. Folks also expressed that it's really difficult to get in to see a primary care provider And at the same time, in our secondary data, we're seeing decreased rates of certain prevention screenings and care, such as decreased rates of mammograms, children receiving certain vaccines, or childhood development screenings. In the community survey, over a fifth of community survey respondents also felt that it was hard to access specialty care. So transportation was one of the places where this was really noted as a barrier, especially when the services are located outside Addison County. And that was a theme that came up also more specifically with the older adults who were part of our focus group, and saying that it could be really challenging to access that kind of specialty care that you need if you have to go to Dartmouth or even up to Burlington. Lack of providers and frequent turnover was also mentioned many times throughout our various data collection methods, both through the focus groups we did with community members and with the healthcare experts and providers. Community members expressed understanding that this is a systems level issue with that kind of constant turnover of providers and therefore having trouble getting in with a provider, but also expressed how difficult it is when you really can't get the kind of help that you need, and that it has a pretty strong personal impact on folks. We do see that 75% of Addison County adults had a routine doctor visit in the past year, and 73% of Vermonters had visited a dentist in the past year. Rates were lower, though, among BIPOC Vermonters and Vermonters with lower incomes. So throughout this process, whenever one of our data methods had the ability to go down into more specific demographic information, we would try to pull that out so we could identify where those disparities are at different population
That shouldn't
levels.
come as too much of a shock.
Pardon me?
That shouldn't come as too much of a shock.
Yeah.
Right?
Yeah, absolutely. So when looking at kind of health equity and where our opportunities are for making improvements, it really is those marginalized populations that we continually see facing barriers in a lot of these different areas. Healthcare access, housing, mental health and substance use, kind of focusing in on which populations are kind of having those barriers. That's where sometimes we're also seeing the most, I would say, opportunity kind of focus in. Even with things like accessing healthcare and the language barriers that are there, if folks can't get access to language access services quickly or in person, it makes any system that is being navigated more challenging for folks. Okay, next slide. So housing, this is another one that I don't think comes as a surprise to anyone. We know that housing is a huge need in our community throughout Vermont, throughout the US too, but definitely something that folks are really struggling with. As with the other sections, we pulled multiple different data sources for housing, and actually one was the Regional Planning Commission's housing survey that you all did recently, so some really good data in there. In our community health needs assessment community survey, over 43% of the respondents did not agree that they could get affordable housing. And considering how many houses are considered financially burdened by housing costs, that isn't surprising, but it is pretty concerning. According to the Vermont housing data, almost half of renters are cost burden, 26% of which are paying more than 50% of their income or more towards housing. So when asked about ways to improve housing in the communities survey respondents wanted increased availability of housing and affordability. Those were both key. And across the data methods, we heard that Addison County needs more housing in general, but specifically our community could benefit from housing that serves specific marginalized populations, such as sober living, respite care, housing for older adults, affordable housing with adequate support services, housing for people with criminal records, housing that really meets the needs of specific populations. It was also important for folks to have multiple types of housing to match different household makeups and needs. So anything from apartments, single family houses, duplexes. Again, I think this probably doesn't come as a surprise to this group since this is kind of the work you do. Just in general, people seeing need for kind of that whole range of housing options. In the community survey too, one thing that was kind of stuck out to me is that 59% of respondents said that they anticipate needing long-term care services within the past year or within the next 5 years. And kind of underlying all of this,
Sorry, what was that percentage?
59% of community survey respondents anticipate needing long-term care services in the next 5 years.
In the next 5
In the
years?
next 5 years. So whether that was for them or like for a loved one, we see that there's like
So it didn't
this,
have to be for them.
not necessarily for them.
I was just reading, I just happened to have this crack to write to that statistics. I'm looking at 58% of people anticipate needing long-term care services and support. That doesn't indicate that they need it for them. It could be for their elderly parents that they're taking care of.
Based on how it was phrased, it could be, the survey was open for anyone that was 16 years plus. So if they got to that question and as the caregiver, for example,
27.
one thing that we heard too in our focus groups, especially from older adults and caregivers, is that it is just so hard to get into things like memory care and that the
Amen.
wait lists are super long.
Well,
So we heard,
Once once again.
not surprising,
No,
yeah.
try selling long-term care insurance for a living. You'll find.
You know,
you'll
long-term
find a
care
good way to
insurance
go
also
broke in a
came
hurry,
up.
for one.
Folks talking about how important it is, you have to have like the perfect type of insurance or otherwise it becomes very unaffordable for people to get in. We heard that from people in the
Well,
group
you have
too.
to have insurance in the first place. And secondly, the Medicare and Medicaid programs aren't gonna cover it.
Yeah,
My family recently looked into long-term care and in 3 different states, Vermont here was the most expensive,
really.
hands down.
Yeah.
It was amazing how expensive it was.
Even if you get through the 50-page application for long-term Medicare aid, even if you get through that whole process.
Yes.
to-
For Medicaid,
For
long-term care.
Medicaid, long-term care, even if you get through that, I just got the review, another 20-page application in the mail, like, oh, I gotta go through
For
this
Medicaid.
again. And this is something that an elderly person could not do.
No,
Right.
I'm just saying this because I just spent a whole day sitting with court-appointed guardians,
Yeah,
going through their client list with their Medicare and their long-term care
Yeah.
Medicaid.
it's crazy.
Yeah, it sounds
it's a
like you all
full-time
really
job.
get it.
It's capitalism.
Well, it is, there's just no money and no beds, and one of the reasons there's no beds is there's no money. It's like
There
the-
was somebody's placed in the last week that I played tennis with. And the closest he could get was up in Burlington, near the hospital.
Gazebo.
The residence at Quarry Hill, I believe is where he's at.
Yeah, yeah.
And you know, my guess is it's gonna be 2 years before he moves down here. If he
Well,
lives that
hopefully
long.
sooner than that.
But
Hopefully sooner than, yeah, the grand senior look. I know we're totally off topic, but you know, they're
There's beds in
they're
Virginia.
anticipating being open
Yeah.
in spring,
oh,
maybe
okay,
summer at the latest, but and it's a really big facility.
Yeah.
And it's been in the
Yeah, it's right-
progress for a
right near the
long
park.
time. Yeah. They're taking applications.
I'm
okay.
just amazed at that statistic though. I mean, you're pushing basically 60% of the population agrees that they're, either they
58% of the
or one of their
survey.
family members is gonna need this.
58% of the survey responses, that's not the
That's
population,
That was
that's the
it's like
thousand.
a
Thank
thousand
Thousand
people.
people.
Thank you.
Yeah.
The,
It's still a
the
powerful
data,
number.
the representative data, 60%
number.
of the representative data illustrates that there's a need for this. But
Yeah.
we talk about all this housing stuff, and I just literally have been spending, you know, whatever, 50, 60 hours a week on the phone with Medicare, and I get calls from people all the time. You know, oh, I've gotta think about moving from my house because I can't keep up with it and I don't have any more money. And you're living in a, you know, $500,000 to $1 million+ home. And you won't leave because there's nowhere to go.
Yeah. Mm-hmm.
And that's that transition plug that can't seem to free up the housing in the more rural areas for, in exchange for living in the denser living community that this aging population is looking for.
And would benefit from immensely.
Immensely,
Immensely.
absolutely.
Yeah.
Yeah.
Yeah, if you could either get them to move, get them to sell their house, or there is a better option for them to go to, because
Right.
there's a prohibitive push-pull there.
Yeah,
I
yeah,
think we still
Sorry.
have more presentation to go.
Thank you.
all right.
Well, I'm glad you all find this so engaging. We'll go ahead and go to
We
the
got
next
all
slide.
day.
Yeah. All right, and for the third priority that came out, and these are in alphabetical order, they're not in like first to third. The other top priority is mental health and substance use. So there were a lot of intersections between mental health and substance use, so we ended up talking about these together. According to the community survey respondents, over a fifth of them did not agree that they could get mental health services, and over a fourth of the community survey respondents did not agree that they could get substance use treatment. During community member focus groups, people share that they struggled with crisis services. When someone was in crisis, they wanted to be able to call someone who was eager to help, welcoming, very knowledgeable. They needed to be admitted to the hospital. They really wanted to be able to get help quickly and be in rooms that felt super welcoming. But when in crisis, some people felt like they just weren't quite getting what they wanted. And unfortunately, it could be difficult to get preventative care. So some people found it difficult to get the care that they needed until they got to that crisis point and were admitted to the hospital. So we see some opportunity there to work with partners on crisis services and also look for some of those opportunities to intervene earlier, so that we can help people from getting to that point. Some people also said that they felt stigmatized and tokenized in the community. So while there were programs that are trying to address stigma, participants still felt that the broader community may not fully understand or welcome them, or kind of understand what they're struggling with. And so there was an opportunity there also to educate the community on mental health disorders and working on creating that inclusive community. We also see that healthcare and other social services can be really complicated to navigate. And the more organizations, the more that they collaborate, work together, the easier it can also be for people to get their needs met. So while organizations were starting to work together in new ways through COVID, it also impacted turnover and some of the ways that organizations functioned. So there's also opportunity to kind of increase that interagency collaboration and care coordination to try to make it easier for folks. And this is, a big systems level thing that requires a lot of collaboration and understanding how different organizations work. But the opportunity to dig into that and figure out how we can make some of the resources that we have work better for folks is something that kind of came up repeatedly too. All right, we can go
If I
to
could
the
just
next.
jump in for a
yeah.
second while you're changing slides. I feel the need to share the most depressing email that I get every week, which is the number of people waiting in Vermont emergency departments for mental health placement. And as of last Thursday, which is the last data I have, the 7th, 17 patients were waiting in emergency departments in Vermont, 13 less than 24 hours, 3 for 1 to 6 days, and 1 for a week or more. And that whenever I get that data, it just always strikes me, how much need there is and how many people are, in our emergency room sort of without the ability to get the care, that they would get more intensive care if they're able to have an inpatient bed. So, yeah.
Yeah, thank you so much for sharing that. That was something we heard too, is community providers wanted to be able to meet people where they're at, get people help as soon as they were ready. And that lack of resources sometimes made it really difficult to get people into programming. Yeah, that makes it really difficult. And I'm trying to keep track of my time here and I see that we're at 7:30. What time? I think 7:30 is when we were planning on wrapping up, so I can try to get through the rest of this.
Why don't you keep going and if folks have questions?
Okay, all right. I want to
Which you know we do.
respect y'all's time. Okay.
We enjoy talking about these presentations.
Okay, great. All right, good, because the next slide is about community assets. So while a lot of the report is focused on what we need to improve, kind of what some of our concerns are, I also wanted to highlight some of the strengths that came out of our process. Our community, Addison County, is really a resilient and connected community. Across the methods, we heard that organizations want to collaborate, they like working together, they trust each other, and they're willing to look at ways to improve some of that coordination. And community members also expressed that they're really thankful for providers and caseworkers and the individuals that they work with and are able to develop trusting relationships with over the years. So it's pretty clear that one of the major aspects, the assets in Addison County are the people that are here and who are trying to work on these issues together. In the community survey, over 90% of respondents agree that they trust their neighbors, and over 80% of community survey respondents agree that they feel safe, people help each other, and that there are ways to take part in social life. So while a lot of this work is focused on what we're trying to improve, we do have some really important key foundations and strengths to build on as we kind of look at what we want our next steps to be. So next steps. Right now, we're in that process of sharing out the results. We want organizations in our community to hear what community members were sharing with us through this report, make it available for folks. Some organizations use this report for example, applying for grants or informing programming. So really trying to just make this available for people that might want to use it. Like I said, it's on Porter's website. It's available online or in print. So we're out doing presentations right now and just trying to get it to anyone who might be interested in learning more or discussing it further. And then the community health improvement plan, that's the action plan that we'll be moving to next. So starting this week, next week, I'm pulling together organizations, people from some of our community partners who are going to be looking at the results and what we have the capacity to work on together to start to chip away at this. So we'll be looking at both kind of short-term things that we can work on together and long-term things. Because we know it's an important balance to have both immediate needs taken care of, but also looking at some of those longer-term systems level issues that take a lot of time or really complicated to work on, but require long-term collaboration so that we can start to make progress on some of the more complicated goals that we may set. So I'm really excited to get to that stage now that we've kind of heard from folks and we have this data. I'm looking forward to kind of putting into pen to paper and thinking about what's actionable, what can we actually do next. And I also wanted to hand it over to, oh, sorry, did you say something?
Oh, shall I go next or no?
You can keep it on the previous slide. Yeah, I'm gonna give it over to Emma, see if she wanted to share a little bit more too.
Yeah, just thank you, Amanda, for sharing so much about your process and all the data. And just wanted to put it out there that like I said, I work in the local health office. Our focus is really on promoting local initiatives around public health, around prevention, around planning. And so if there's ever ways that, myself in my role or other folks in our office can be supportive to all of you as regional and town planners, I'm really open to looking for ways to work together. I'm fairly new in my role, and I think my predecessor was working with some folks on the Regional Planning Commission pretty closely on different initiatives. So please just reach out. I know some of my counterparts across the state have worked on things like thinking about health promoting language in town plans, providing any resources or support around that to raise awareness in your communities, to help think about what is important to get some of those ideas out there and make them kind of actionable and individualized to each community. Thinking about ways that if we can be helpful in sharing any of the health department data that is relevant to work you're doing. So again, my contact information will be at the end of that as well. So I think there is a lot of overlap between the sort of public health work and the planning work that you all do, and really happy to partner on that if there's ever ways that it makes sense.
All right, next slide. So we just wanted to give time for questions and discussion, and I'll look to you all to see how much time you'd like to dig into that.
I have a question, actually, to kick it off. It's a methodology question, with sort of a point to it. What was your time period that you were collecting the data in?
Yeah, good question. So our process started, it really kicked off in April. And we wrapped up data collection this summer. You know, I'd have to look back at the our timeline in there, but the community survey was out during May, the month of May. So we had a month to collect that data from folks. And I believe it was during the next month that we completed our focus groups. And during that time period, we were kind of continually collecting the secondary data and things that already existed so that we could integrate those and look at all the data together to pick out the priorities.
Cool. Yeah, thanks. And the reason I asked the question is I'm curious about your assessment of the impact of the ending of the motel program for homeless families and individuals that happened recently. And that sort of seemed to happen sort of, I guess, a little bit at the tail end of your data collection period. And so I'm wondering if you think maybe it was good that your data collection period is earlier because more people were able to participate because they were at the motels. Do you think that this was something that is, there are now perhaps more homeless people in Addison County communities, and so thus it may not fully reflect reality anymore due to the data collection window? How do you see that impacting things?
That is such a great question. So of course, I'm just hazarding a guess, but I'm sure if we collected data at different points in the year, we might see maybe more folks who answer the question about what their housing situation looks like. Maybe that would be different. Collaborating with Charterhouse, we had some incentives so that we could basically thank people for their time for taking the survey, especially with marginalized groups. So when we worked with Charterhouse, we had some $20 gift cards, actually collaboration with the Regional Planning Commission to get folks to take it. So that's primarily who we heard from for folks who might have housing insecurity questions, who would be reflected in the survey that we completed in May. I know that the point in time count is coming up in January too, so I think it'll be interesting to see how that has changed, maybe comparing, 3 years ago point in time count to last year to what it might be this year. Definitely something to keep an eye on, and I can also give a little more information, I guess, on next steps and how we're going to be looking at that. So because there's a really active housing coalition in Addison County, and one of our goals is to not duplicate any efforts. We either want to lift up existing efforts or add to existing efforts, or kind of work in concert with. When we're developing the housing work plan for the CHIP, we'll be working really closely with the Housing Coalition, and they have a great kind of finger on a pulse for what's going on there.
Great, thank you so much. That was it was really interesting. And I see Rich has his hand raised, so I'll hand it over to him.
Hi, I didn't see much in your slides and report regarding diet and lifestyle. Can you comment on that? I guess I'll add one more thing. I saw something about social determinants of health. Is there anything you did in your study of personal choices as a determinant of health?
So for your first question, kind of about food, on the community survey, we asked a question. I think it was, can you get the food that you want? I might have the phrasing slightly off, but we did ask folks about food access. And that was something that you'll also see talked a little bit about in the cost of living section. There wasn't as, that was kind of the main question, I think, through the community survey was about food access. That's where we saw it come up most specifically. We do know that that is closely tied to cost of living and also health outcomes and chronic disease, you know, folks having access to healthy foods. So I definitely see that still as an important topic that kind of like the other things that may not be a top priority, they're still kind of interrelated. So that, yeah, that's a little bit about where food is. It's, if you're reading about it, it'll be in the cost of living section. Might be something to explore additionally in the next one that comes up in 3 years. And then your
What
second
about,
question was about social determinants.
Well, you had a thing on social determinants as has a influence on health. What about personal choices like your lifestyle?
I can,
And
Amanda, I
go
can
ahead.
chime in a little bit. So I think for me, the way I think about the social determinants of health is, do people have the opportunity to have those things, right? Do people have equal and just access to healthy food choices? I don't think it's about necessarily, you know, people have choice in their life and they make choices, but do they have access to foods that are nutritious, enough food to eat? Do they have access to the foods they want, foods that are culturally relevant to them? I think when I think about the social determinants of health, that's what I'm thinking. And same thing when we're talking about really any of those choices, right? Do people have equitable and equal opportunities to access those types of resources? And I think that's part of, so you know, my role is with the kind of local chronic disease prevention efforts, and certainly working with groups that talk about food security, talk about supporting, you know, local food initiatives, things like that is certainly a piece of that, and a piece of the public health model around that.
So it sounds like your focus is mainly like, what can the world around people do for their health rather than what sort of actions they can take for their own health. Like, am I getting that right or?
I'd say a lot of it is kind of focused on those systems level things so that we can wrap around people with healthy opportunity. And that makes the healthy choice the easy choice, is maybe one way you've maybe heard it referred to before. But yeah, kind of like what Emma was saying, looking at some of those systems that we can set up so that we can set people up for success.
Yeah, and I think
Right.
we're all of us are we're small pieces of a larger puzzle, right? There's certainly folks out there that their focus is on education around those things. There's healthcare providers that have a role in that system around education and support. So there's kind of different, I think, tiers of community supports that are working on these like spheres of health.
I think Ron has a question.
Sorry, I'm
Thank you for
just
the dialogue.
keep my place until you're done. Keep the conversation going. I mean to end the question, but I do have
Yeah.
a couple of comments and observations. One, kudos to Amanda and your group for putting this together. I know the time period that you had to do this, it was relatively short. You really did a remarkable job in providing just tons and tons of valuable information. And Adam, kudos to you and your staff for your participation in this. I think it's really good. And I think there are opportunities to kind of walk this document back to what we do. And I think it's going to be important if we want to see progress here, that we kind of find what's our responsibility in implementing this. As kind of a backdrop, we're all reading the newspaper. We know the state of healthcare in Vermont. We know costs are spiraling out of control, with a plan in place that is getting tons of pushback from our healthcare system. So we know that these health changes that Amanda is bringing to our attention here, it's going to be really hard for our healthcare systems to be making forceful changes in here where they're looking at serious cost containment. I don't know how they can start thinking about this when they're in this mindset of how do we stay within budget? How do we not reduce premium? So we've got this crazy situation here. And I think it's important for us to start looking at health as something local. Again, terrific job looking at health across Addison County. When you start drilling down into census tracts and neighborhoods in Addison County, it's really a tale of two cities. There are some places where there is incredible health, and there are other places where there is bad health. And if we really want to make those changes in improving overall health, research tells us healthcare can influence health 20% of the time. 80% of what influences our health are the communities we live in. To Rich's point, to the lifestyles that we choose to live, if we have the options to make those changes, which many of us, don't. When you start looking at health at a local level, it tells a very different story. Let me just throw a couple of points out. The prevalence of disease in census tracts go up dramatically when you start looking at a census tract like 9603 presents. 38% higher prevalence of strokes, 23% higher incidence of heart disease, 28% higher incidence of diabetes. So when you start looking at the prevalence of disease and illness, it differs from area to area in our region. And our approaches really need to, I like the idea of prioritizing our top three, but when it comes to health improvement at a local level, we can't just kind of say we want to work on these three when these 5 issues are also influencing. So for me, doing place-based health improvement becomes really critical if we want to do this. So how do we take this back to our planning groups in our municipalities, and how zoning is done, how walkable communities are created, how connectivity amongst neighbors are created? That's where I think we have the best influence of improving health.
Yeah, if you want to talk to someone about place-based health, Ron's your person. We had a coffee chat a couple weeks ago. Yeah, and there's a lot of power in meeting at the local level and seeing what's really important and what moves people at the town level. Kind of to Emma's point earlier too, one of the opportunities there, at least at the kind of higher planning level, is looking at town plans and saying, how do we promote or kind of codify that importance of health in some of our foundational town documents. And that's certainly something that this data can help inform, or collaborating with Emma can help inform. I know the health department has multiple templates available. I used to hold a similar role to Emma, except in Chittenden County. So a lot of resources out there to kind of look at the town level municipal decisions and how those can be kind of analyzed for positive and negative impacts to health, and how we can kind of raise up the positive ones.
Do you have
One
any
question.
other questions? Yeah, unless something else pressing, let's make that the last one.
All right.
On page 30, there are state averages of the booklet. State averages, and we're not the highest. Is Chittenden County higher than us?
Generally, Chittenden County is higher. I'd have to double check that for sure, but generally, when you look at data, if it's at the county level, Chittenden County is higher.
Thank you.
Yeah. All right. Thank you all so much. We really appreciate you taking the time to discuss this with us. If any other questions come up, feel free to reach out to Emma and I. If you want to, please keep the hard copies if you like, and if you don't want them, I'm happy to take those with me. And if you don't have one and you want one, just let us know and we'll mail one to you.
Yeah.
Thank you so much.
Thank you. We appreciate your time.
Thank you.
Just how to get in touch with you in case anyone has a question that may come up later. Is there a good place they could find your email address or something like that?
Yeah, I know that.
Go ahead, Emma.
I was just say they're on the slides, but certainly if there's an email that goes out to the group, we can put them whatever works the best to get in touch with you all. I think email is probably the easiest way to reach either of us.
Yeah. Are there notes that go out and we can just
include it in the minutes?
perfect. We'll
Great.
that.
Yeah, feel free to reach out. Thank you.
Cool.
Thank you,
Well,
everyone.
again, Thank you both so much. That was fascinating. And I really thought that the conversation was really interesting too about place-based health stuff. I did some work on healthcare in the legislature, and so it is something I really care a lot about. But with the presentation being over, we will move on to our business agenda. The first item for our business agenda is the approval of the minutes from the October 11th, 2024 meeting. Does anyone know any errors or omissions in the minutes?
Move the minutes as.
Hearing. Yep. Great. Ross, was that you?
Yep.
Cool. Okay, that's a motion from Ross to approve the minutes. Do we have a second?
Second.
Thank you.
Thank you.
It's moved and seconded to approve the minutes of the October 11th, 2024 meeting. Is there any further discussion? Hearing none, all those in favor, please indicate by saying aye or raising your hand or something like that.
Aye.
Something like that.
And all those opposed, please indicate by raising nay, say nay, or indicate by raising your hand now. And are there any abstentions?
I abstain. This is Joya.
Okay, thank you, Joya.
Thank you, Ron.
Great. Thank you all very much. The ayes have it, and we've approved the minutes from the October 11th, 2024 meeting. Next item on the business agenda is the executive board minutes, but there was no executive board meeting. So there's really nothing to talk about. And so we will have those next month. The next item after that is the treasurer's report. And for the treasurer's report for the financials of September 30th, 2024, I will hand it over to Adam.
Great, thank you, Joe. Let's see, treasurer's report. So the statement of financial activities and the statement of financial position went out in the package. I'm just gonna summarize them without putting them up. If you have questions or want me to put them up, please let me know. Starting with the statement of financial activities, through September 30th, which is basically the end of our first quarter. We had income of $338,000, expenses of $271,000 for basically net income of $67,000. And if you'll remember, in August, we were actually down about $38,000. That really reflects the nature of how we bill. We bill a lot of bigger accounts quarterly. And those have come in, and basically we're back in the black, which I am happy to see. Any questions on the statement of financial activities? Okay, moving on to statement of financial position, and this is basically our balance sheet. So I will tell you, we have current assets of about $1.2 million, liabilities of about $757,000, leaving equity of about $489,000. That $700,000 in liabilities. Accounts payable were up a little bit. I think that's a timing thing at 137, but most of those, most of our liabilities are unearned revenue. They're prepaid amounts, so there's money showing in our bank account that we haven't earned yet. So the accessory dwellings, the clean water service provider is the biggest one, the MERP building grants, etc. So overall, I would tell you we are in good financial health.
Thank you, Adam. Does anyone have any questions for Adam?
I might
Joya.
Yeah, hi. I had a couple questions. One was about the reimbursed expenses, which was quite large, and I'm sure you have a reason for it, but I need to sorry, I'm going back and forth from things that I'm looking at here. The miscellaneous reimbursable expenses of $49,000. And then I also was not aware of what the dwelling units was. So if you could just explain to me what dwelling units are.
So I believe the 30,100, so the miscellaneous reimbursable expenses are where we hire consultants.
Gotcha.
basically to do work for us. And generally, most of the consultants that we hire are transportation consultants. So at the end of September is the end of the federal fiscal year. We get a lot of our consultant projects wrap up then. For the TAC, just had a couple of projects wrap up, and I imagine that's what the lion's share of that is.
Great.
And for the, I think it's the health equity program, the $20,000 that we have, basically as, unearned revenue, for the accessory dwelling units program. That is the grant which we got from St. Stephen's Church, that we distribute to people developing accessory dwelling units in Addison County. So we've given away 2 $5,000 grants of theirs so far. We still have basically 4 left and a little bit of administrative expense.
Great, thank you.
Sounded like there was a question in the room.
Yeah, so we're not quite halfway through our fiscal year,
We're a quarter of the way
right?
through our fiscal year.
And we've already got a nice operating buffer of 67,000, and probably saving a little more because we're short-staffed and we're not paying some wages. I'm hoping as the season, the year continues, if this continues with the balance, that you, Adam, and the executive committee will consider maybe revisiting the grant program that was instituted by the commission last year. It seemed like the towns, there was a lot of interest and was very well received, and maybe that could continue.
I think that's a great suggestion, Ross. It's something I'll bring to your e-board and then back to you eventually, when we get a little further into the year.
Any other questions for Adam? Hearing none, I'd entertain a motion to approve the treasurer's report for September 30th, 2024. Peter, thank you for that motion. And the second from Nick. Is there any further discussion around this report? Hearing none, all those in favor, please indicate by saying aye or raising your hand.
Aye.
Hi.
And all opposed nay or raise your hand at this point. And are there any abstentions? And the ayes have it, and we've approved the treasurer's report for the September 30th, 2024 financials. The next item on the agenda are the committee reports, starting with Act 250. Is there an Act 250 report?
I will give the Act 250 report. Steve, the chair, isn't here tonight. So the Act 250 committee met last month jointly with the Energy Committee. So our reports may overlap a little bit.
Right.
For the Act 250, I will stick to, I guess, well, both the Act 250 and Energy Committee looked at a request that we had received from a citizens group and their attorney, Jim Dumont, for the Addison County Regional Planning Commission to participate in the latest version of the Vermont gas pipeline reapplication for a certificate of public good. So Vermont Gas first applied for the pipeline in 2014. They were granted a certificate of public good. A number of people raised questions, concerns about the pipeline and how it was constructed. Appealed that to the Public Service Commission. No, excuse me, Public Utilities Commission. Public Utilities Commission basically found that Vermont Gas did not meet some of the conditions of the certificate of public good they were granted. Namely, the biggest issue probably is a place in New Haven where the line was not buried to 4 feet as required. They fined them $150,000, but then they did go back and issue them another certificate of public good The opponents to the project appealed that certificate of public good to the Supreme Court, saying that the Public Utilities Commission could not just basically issue another certificate of public good once it found a violation. It needed to go back through the entire process, the public process again, and give the public an opportunity to comment. The Supreme Court basically found in favor of the opponents to the project and reversed the Public Utility Commission's decision and ordered Vermont Gas to go back before the Public Utilities Commission for a new certificate of public good. Let's see. Vermont Gas has filed, I believe it's 45-day notice. It has filed its 45-day notice for the certificate of public good, or saying that it will go back through the process. The opponents to the project have said they would like us to participate in the process, so intervene in the process. The Act 250 and Energy Committees basically decided to recommend to you all that we do intervene and participate in the process, just to keep tabs on it and to give our member municipalities and you the ability to ask questions about the line, should you like to do so.
Can I also?
How'd I do?
Yeah, you did great. I only want to add that one of the benefits of being an intervener is that you have access to the information that they are gathering. So when they hear from an independent engineer on the depth of the pipe, we have access to that information as being an intervener, whether we actively participate much at all, at least we have access to all of that information that we can then disseminate to our towns if they are interested. That was the compelling thing for me to be an intervener, is just to have access to the information that might be talked about.
So Joe, can I make a comment?
Of course, go ahead.
Yeah. I didn't know how to raise my hand. So, I don't know all the ins and outs of the particular proceeding, but it certainly seems to me to be appropriate for the our regional planning commission to participate. It's a member municipality. Without taking any position at this point, I think it's a very supportive and useful thing for us to participate.
I have a question, which is, what would determine our position or strategy with regards to our intervention? And what I mean by that is that through intervention, do we then sort of open up the question of to what extent we ought to be intervening or what extent we ought to be participating, and how do we balance that against, potentially how we would make those decisions as an organization, but also some of the budgetary impacts of legal fees.
Yes.
Want me to answer that, Cheryl?
Yes, please.
Okay. So the Act 250 and Energy Committee, basically, I think were pretty clear to me that they wanted us to intervene and monitor it and have the ability to ask questions, but they were not looking for us to take a position on it, either pro or con.
We did
At
not
this
want,
time.
yeah, we did not want Adam to be burdened with attending every time there's a hearing or really stretching his thin resources any further, but just kind of be able to watch the process go without committing us in any direction, Joe.
But of course, now also we have the luxury of being able to attend via Zoom. So you don't actually have to go. You could have it on in the background or at your office or whatever, whenever the meetings are, potentially, if you needed to. Shouldn't be too much of a inconvenience, hopefully.
It's a big process. Jim's been doing it for 8 years now, right? So it's not something to take lightly if you really want to present and take a side one way, but monitoring is not that much of a burden. And if there are things that come back, I can report them back to you and you can decide how you want to react.
I
So,
see.
so Joe,
Go ahead.
yeah, so Joe, I think Adam described the process pretty well. They're going to monitor it. It leaves open, if in monitoring it something seems to be important that we can weigh in, then we can make that decision. If you don't decide to, participate now, then you lose that opportunity. That's why I'm thinking it's a good idea to participate now.
Mhm. Much to Adam's dismay.
So I'll make a motion that we accept the recommendation from the Act 250 and Energy Committee to have Adam participate and monitor with potential more if the commission feels necessary.
Okay, so we have a motion. Is there a second to that motion? Stan, I see a second. And then Ross, just to restate it, because I want to be sure we're clear on it. So for the commission to accept the recommendation of the Act 250 and Energy Committees to intervene in this pipeline matter for the purposes of monitoring and potentially, if the commission is to choose at a later time to take further action. Is that an accurate restatement?
I think so. Thank you.
Great. Okay, thanks. So that being the motion, is there any further discussion on that motion? Hearing none. All those in favor of the motion that was just stated, please indicate by saying aye or thumbs up or raising your hand.
Aye.
And all opposed, say nay or raise your hand or thumbs up at this time. And any abstentions? The ayes have it. I saw Peter as an abstention there. The ayes have it. And we have voted to intervene in this matter for the purposes of monitoring, getting information, may potentially make other decisions in the future. Next, so would we consider that the joint Act 250 and energy report, or does energy have something further to report?
The only thing to add on to it is afterwards we discussed how to proceed with the enhanced energy plan that Madison drafted before she left. And we are individually looking at the document as we speak. And then on Monday, when we meet again, we will look at it collectively to see what we need to do to get it over the finish line. We were kind of hoping to present that next month to the full commission, but we may need a little more time for that. So we are working on the enhanced energy plan.
Great, thank you very much. Next on the list is local government.
Did not meet.
Okay, natural resources. Hearing nothing.
Meeting soon.
Cool. TAC.
Well, Joe, can I back you up to natural
Yep.
resources for just a second?
Yep, please.
And I'm not sure if I saw Arabella earlier. I'm not sure if she's still here. She's the chair. I know that Hannah and Leander sent a comparison of basically the natural resources section of our plan and the tactical basin plan for Otter Creek to the Natural Resources Committee. Basically, they did a staff analysis and compared them in order to, we had the basin plan presented to us at our October meeting. They have asked us for a basically I'm getting the terminology wrong. I'm gonna call it a certificate, a letter basically stating that the plans are compatible with one another. Leander basically and Hannah reviewed it, and that was staff's finding. So we were gonna ask the Natural Resources Committee to review that and make a recommendation to all of you prior to this meeting. Would you be willing to delegate that authority to the Natural Resources Committee. They can basically look at staff, the staff memo and make a decision themselves, so we don't have to wait another month to get that letter back to Angie Allen in the Otter Creek Basin Program.
I would make that motion, Adam. That we
Okay.
give the authority to the Natural Resources Committee to make that decision. Second. Because of the timely nature.
Great.
Unmuted. Motion's been made and seconded to delegate the authority to the Natural Resources Committee. I see Stan has his hand up.
We have not received that review yet, Adam.
Okay, let me. You will get it shortly. You will get
Thank
it
you.
very shortly, so I will speak with Hannah about that. Okay. Thank you for the allowing them to do it. I think it's a relatively easy task, and it'll just save us a lot of time to respond, so I appreciate it. That's my comments. We still need a vote, Joe, I think.
Yes, is there any further? Can a commission delegate to a subordinate body? I'm just thinking through my Robert's rules right now, and I know that you can. Yeah, I'm not sure on that. I'll be completely honest. From my Robert's rules, and I have my book right here. I don't. I mean, we could vote on it, and I could look it up, and if I find it's a problem, I could let you know. And we just do something different. Or what do you think?
Let's
What's the question?
work that way. I think, you can empower subordinate bodies to make decisions for you, right? You can empower me to sign a contract. You can empower the executive board to sign checks. So I think
True,
it's something
yeah.
similar
Okay.
to that.
Yep. Okay, that makes sense to me. Yeah. Okay. Cool. I'll look it up later. So does any further discussion? Hearing none. So all those in favor of delegating the authority to the Natural Resources Committee to make this change, please indicate by saying aye, raising your hand, or giving a thumbs up.
Aye.
Aye.
And any opposed? And any abstentions? The ayes have it, and we have delegated that authority to the Natural Resources Committee. Anything further from Natural Resources? Okay, TAC is up next.
I guess I'll take that. The TAC met, we had some study grants. Roughly $55,000. The problem is that when we partition it, we don't get the bids that we like. So Mike was going to try to see if we could get a single bid that would partition that money as needed to meet the needs of Middlebury, Bristol, and Ripton on what they wanted to study. And I have not heard an update since then, and I should have checked before this meeting, and I apologize.
So I think Mike's bringing that back to the TAC because with the administration change in Middlebury, they're not interested in doing the study that you applied for the grant for. So we've got to figure out, that leaves us some extra money, and we've got to figure out what to do. So that will be one of the topics at your next meeting.
Thank you.
Thank you very much. Next up is housing.
Housing met just before tonight's committee meeting. And thanks to our friend Adam, we dug into the flu. For those of you not in the know, the flu is the future land use methodology and process, which is a dense document, and I'm being generous.
Sounds like fluff.
It's a document that we'll need to do some work on, and that is being used, as I would guess best, like a template for future planners and GIS. Is that fair to say, Adam?
Yeah, I'll summarize this a little bit later on in old business.
Okay,
Because we've talked about Act 181 a couple of different times
I'm sorry, I should have
before.
referenced 181.
That's all right, which is the Act 250 and housing bill, and I've been working with your housing committee to put together an outreach plan for our municipalities on how we work with them to make sure the future land use plan we create at the regional level reflects the desires of the communities and the local plans. And so I'll talk about that a little bit further down the program.
Great, thank you. Next up is economic development, and I will do that report. The Economic Development Committee did meet on Halloween, and we met in order to look at area-wide planning proposals, and this was in our capacity as sort of the brownfields subcommittee. We're sort of a subcommittee of ourselves. And this was to look at something called the area-wide planning, which an organization known as Stantec. We were looking to work with them. So we ended up approving the full Stantec area-wide planning proposal for $32,300. And there's a requirement that the windshield property visits happen when there is no snow cover. So in order to avoid anything like that, and Adam can correct me if I'm wrong, but this was something that was already allocated in the budget, so we just approved it. And that was pretty much that with the Brownfields Committee, as far as I remember. Anything I miss, Adam?
No, that's correct.
Awesome.
The grant that we received from the EPA for the brownfields included us a fair amount of money for area-wide planning. And the Brownfields Committee just allocated a portion of that money to the areas that underlie where we're doing the transit-oriented development study, or the housing study in Ferrisburg, Virgins, and Middlebury. So the idea is to basically help those studies along by looking for potential brownfields in that area and noting them, so that if and when we develop housing in that area, we'll know of parcels that might need some brownfield studies prior to doing it.
Great, thanks. So that was all our committees. And the next thing on the agenda is joint partners report, delegate and staff recognition.
Okay, first I wanna thank Andrew for doing the newsletter. One of the things I want to highlight in there is the money from the bond bank for small water systems. It's a grant. It's due December 2nd. I'm thinking specifically of Starksboro and Ferrisburg and Bridport, who all looked into money for their water systems, and the MTAP grants didn't get any, but have viable projects already put together. And I think it would be great for them to apply for some of this money. It's basically $1 million in this round statewide. And their applications were all $60,000 for looking for ways to improve their small water systems, which is exactly what this grant's focused on.
And what's the channel, like, for example, in Ferrisburg, what?
Your
channel?
select board.
Okay, so that's what I needed to know. That needs
Yeah.
to go through our select board. at our
They'd
next
need
meeting?
to sign the application, or authorize somebody to sign the application.
Okay, and the
Yeah.
application could be completed through here.
Yes.
Yeah.
Yeah, it's a pretty quick application.
Okay,
And we would certainly help you. Yeah. So that's what I wanted to highlight there, Joe.
Great, thanks. So the next thing that we have on the agenda is old business, starting with a Maple broadband update.
Actually, I guess I'll give that as well, but I should also acknowledge for the joint partners report. Fred Kenny is here from Madison County Economic Development. And Fred and I and April and one of his, so our bookkeeper April and one of his staff members, new staff members, Nicole, have been talking about her using some of her time basically to help April out. So somewhere between 5 and 10 hours a week. And April and Nicole are meeting next week to try and make that happen. So I really appreciate Fred helping us make that happen and getting April a little extra help.
Thank you, Fred. Good to see you.
Glad to assist.
Yeah. Anything else from there? Cool. So old business, Maple Broadband.
So I can give this report, or there are a couple other
I-
members of the board. Shannon's on the executive board.
Yeah, I can jump in. So as of last Thursday, we're up to 481 paying subscribers, which is great. We're closing in on 500 before the end of the year. At last night's governing board meeting, we held a public hearing for public comment on our annual report and our annual budget. There'll be another round of public hearings at our December meeting before they're finalized. And then just continuing to work on waiting to see what's going to happen with the BEAD process, the BEAD grant process, and being able to apply there. Those are the highlights.
We're on schedule and under budget.
Any questions for Shannon? Nope. Okay. So the next item for old business is staff hiring.
So you all know that we are down a couple of positions right now. Fred helped us out with a little help for April, and I just talked about that. I have also been looking for a staff planner and a new energy planner, because I've got a lot of good energy news for us later in the next item. I've held a number of interviews. I've handed basically 4 people off to staff for them to interview. They've started that. I'm hoping that we will make a couple of good decisions, and we've got some really good candidates, applicants. So I'm hoping we will make a good decision for them sometime at the beginning of December, and hopefully have a couple people starting before the end of the year. But I'm pleased with the way it's going so far.
Nice Christmas presents.
That would be nice.
Thank you, Adam. Any questions on that?
Merp.
Hearing none. Oh, yep, Merp.
MERP. So,
Do a happy dance.
yeah, so was it either yesterday or today? Buildings and General Services announced their MERP grant recipients. And I'm happy to say that Addison County, so thanks largely to Maddie and her good work, did really well, or significantly better than I thought we would. So 10 towns were awarded MERP money, and I'm just gonna read them out to you and leave it at that. Orwell is gonna get $420,000, and all numbers are rounded to thousands, so it's about $420,000 to do work on their firehouse, clerk's office, town garage, and sewer plant. Ripton's gonna get $414,000 for its fire station and community house, and this is all energy related work, so it's either thermal insulation or new systems, more efficient systems. Leicester is gonna get $201,000 for its town hall and town office. Starksboro is gonna get $164,000 for its food shelf. Goshen is gonna get $334,000 for its town hall. Ferrisburg is gonna get $166,000 for its town hall and offices. Virgins is gonna get $361,000 for the Bixby Library. Bristol is gonna get $326,000 for Holly Hall. Bridport is gonna get $197,000 for its town offices, and a town highway garage. And Whiting is gonna get $484,000 for its town office and town hall. So, if they sign the grant agreements and get them back to Buildings and General Services before December 16th. So if the community got a grant, they've got to basically read that grant agreement, understand that grant agreement, get the city council or select boards to sign it and get it back in so that BGS can obligate those funds before the end of the year. There are gonna be a lot of questions about this, because some of the grants appear to be less than what municipalities asked for, but the scope of work hasn't necessarily changed. We're gonna talk with BGS about that and a bunch of other questions on Tuesday. We being regional planning commissions, and we have plenty of money in our budget still to help, each of the towns with their implementation steps. So if they have questions right now, they should call me and we'll get a new energy planner on soon to help them out with basically implementing these and putting improvements into their respective buildings. Russ.
Well, yeah, kind of my question is, you said December 16th is the deadline?
Just for the
To
grant.
Just to sign the grant.
Okay. So I was just hoping, I didn't know if there was gonna be staff available to help the towns to get that process done.
I think we'll be able to, so. They've all got awards. I've talked to several of the towns already. It's really a matter of having your legislative body sign it. I know some of them are gonna have questions. I don't have the answers to those questions yet. When I get them, I'll send something out and we'll be available to help any of those towns, but they've gotta have it signed by December 16th. And it's grant funds at the end of the day. So,
No matching funds.
and no matching funds required, so,
No brainer.
we'll figure out the details a little later. The important thing is that they sign it and get it in. But I will be trying to help them with some of the details beforehand too.
That's great news. Any other questions?
Oh, I have an
yeah.
addendum to that too. The bond bank, the municipal bond bank, also just came out with a program funded with $36 million for low interest loans for energy retrofits as well for municipal buildings. So even if you didn't get a grant, every town or nearly every town in the region got an assessment of their buildings and what might make sense. So, one of the things that I will ask the new energy planner to do is basically look at those assessments and put together a scope of work that hopefully will cash flow day one. So, it's a 2% grant. It's relatively low interest. If the paybacks on some of the improvements are small enough, we can look at that and create a package that'll cash flow for your municipality on day one and should improve basically working conditions for your people as well. So that's my goal for those of you who didn't get MERP grants, is to give you another offer that really won't cost you anything over time.
Giant dribble exercise.
That's that report, Joe.
Great, thank you so much. Any questions? Hearing none. Next item is Act 181, Land Use Outreach to Towns.
Okay, so Tim spoke about this just a little bit earlier with the housing committee. We looked at some of the methodology for, well, let me back up, excuse me. Act 181 is a bill or an act now that was passed in June. It involves Act 250 and housing. We've had a couple of meetings on it, so if you remember, it was kind of a compromise bill where we would increase, that purports to increase opportunities for housing within village centers. Also looks to do more conservation work in the rural areas, with a lot of things to be determined going forward. But we have a relatively short time frame, a year time frame to get out to our municipalities and work with them to implement this law in a manner that works for all of us. So we, as the Regional Planning Commission, have an obligation to develop a regional future land use map that basically designates areas for both housing and conservation. We're developing a uniform methodology so that the maps will be consistent throughout the state. The land use board needs to be appointed and needs to make some decisions on guidelines for some of the class 3 areas. So there's, and housing targets, so there's still a lot of work left to do, but I talked with your housing committee about getting out in front and at least getting out to our member towns and saying, this is coming. We've got a series of maps put together to show them where we are now and how we think this might work. So we will be scheduling I think a regional meeting of planning commission select boards that would like to join us and learn a little bit more about Act 181. And then we'll be going out individually to towns and presenting them with plans moving forward.
Thanks. Any questions? Herb?
Yeah, you know, Adam, this is a great report. We were we were very impressed with what Adam was proposing. One of the keys, I think, that we were talking about is to make sure that as we're implementing Act 181, that we do so in the context of some pretty significant housing needs in the state and in our municipalities. And I think the plan that Adam showed us is going to really help in that regard, as well as making some tweaks in the the proposed manual that reflect, I think, a better balance between some of the Act 250 concerns and some of the housing concerns.
Thanks, Herb. Any other questions or comments?
Can I just say that, any advice that you have in reaching out to towns is a great thing that you're doing, because so many towns, also speak from Virgins, is going through looking at, like what is coming up and how can we, change our municipal development plan, like to anticipate some of those things that are going to be in law. And one of it is dumb little things like the parking requirements, if you turn one house into 4, but yet we can only have 1 parking, little things like that, they're gonna look for, help on that. And one of the things that we're also doing is looking at some of the different districts and changing the use to allow housing in districts that was not allowed before, like the commercial district. So really looking at what's coming and trying to anticipate those changes, and any help that you have to the community is going to be really well received from the planning commission.
Yeah, so Katie and our new planner and I will all be going out to different communities, and it's my goal that this is really an opportunity for the regional plan to reflect local interests, right? We want to get input from the communities and make sure that once we're at the end of the day, our plan works as closely as possible with the municipal plans. So so we will get out there shortly. It'll be about a year-long process though, so it's not quick.
Everything is.
Thank you. Any other questions?
I had something that I wanted to ask Adam. And it's about Ross's comment about the grant program that happened last year to the towns. So my worry is that it may be that a good portion of our income comes from federal sources, either through the state or otherwise. And before we talk about or publicize anything about the grant program again, I think it would be smart to just wait and see what's going to happen about downsizing the federal government.
Okay, I think that's a fair comment, and we might have a better vision of that a little further down the line, and when we look at our own budget too. So
I'd just be really curious too. I mean, I know it's a lot of work to figure out what percentage of your budget comes from federal sources and what agencies they come from and what idiots are heading those agencies now. But if you're wanting something to do, and you need some research help, I'm willing.
Okay, thank you.
Other questions or comments? Hearing none. So the next thing listed is other. Is there any other?
Just, I'll give you an audit update, Joe, in that audit is moving along in process. I expect to have a draft for the e-board at the December, I think it's 4th meeting, and then hopefully the e-board will pass that draft on for approval to the full commission at its December meeting.
That sounds great.
And I just
Um,
remind you that
please.
that's on Christmas Eve, but
No, December 4th.
December, 4th, I just said the next executive board meeting.
December, we moved,
25th.
so the one that was supposed to be on Thanksgiving or just before Thanksgiving, we moved to December 4th. And there's no e-board meeting on the 25th of
Thank you.
December.
I was a little bit behind the 8 ball on that one. Thank you very much.
Wait, we don't want to spend Christmas in our e-board meeting? Let's see, next is a new business.
I do not have anything for you.
Okay, any members' concerns or information that anyone would like to share? Hearing none, absent objection, I will adjourn the Addison County Regional Planning Commission until 7 p.m. on Wednesday, December 11th, 2024. And without objection, so ordered. Thank you all very much, and have a happy Thanksgiving, and look forward to seeing you on the other side of it.
Happy Thanksgiving. Thank you.
Bye.
Great, good night, thank you all.
Oh, he runs me. He can.
Yes, I do.
Anticipate.
He keeps it going.